Hi, I'm Dr. Kenneth Levine. Welcome back to Health Talk. Again, we're seen on UVerse Channel 19, WEYW19.com on the web. And south of us here, it can be seen on some Comcast channels, Channel 87. I'm here with Dr. Tom Morrison. Tom, what I wanted to ask you, I had asked you about different facilities. What I was trying to get to is the difference between all your urgent care facilities the same, and what's the differentiation? And what does it mean for a patient to come to you rather than going to a hospital? Say that both of their problems can be treated at the same facility.
Right. I think that's a personal choice. What Baptist has done is created a lot of standardization so that when you come into a facility, you know you're in a Baptist facility, not only because of the cleanliness, but because of the investment that each individual employee and healthcare provider gives towards the patient. You know, Baptist has a symbol of a pineapple. A lot of people wonder why. I certainly was one of them. And the concept behind that is hospitality. We want you to feel like you're part of the family. We want you to feel like we care about you, which we do, right, and that you go away feeling fulfilled and that your problem was addressed. That's one of the standardizations it's hard to compete with at other urgent cares or hospital settings. With that said, the ultimate choice is up to the patient.
Well, I'm going to ask the question again, maybe rephrase it. I broke my arm, okay? And I have a choice of going to a hospital, which is what I grew up with, or I'm going to go to your urgent care facility. What would the difference in experience be for me or my family between the two facilities?
At a tertiary hospital, any of the major ERs, you always have access to subspecialists, orthopedic doctors, things like that. You'll have usually, on average, a larger wait time, but you'll have access to more of the system. So, for example, if surgery is required, right then and there you have access to surgery if it's required. At the urgent care center, your wait time's much less. You'll have the same radiographic access, same x-rays. You'll still be splinted, but ultimately you'll be referred to orthopedic. The advantage, of course, is the faster turnaround time, so your needs are addressed fairly readily, and then you can choose which orthopedic doctor you're going to follow up with.
If a person, maybe a broken arm is a bad example. Person has they fall, they cut their face, they have a flu type thing that you mentioned before. What's the difference in experience for the patient between the two facilities?
Again, the urgent cares have a much more rapid turnaround time. We can see you faster and for less money. The copay is less. You mentioned the facial lacerations. I take care of those pretty much every single shift. But that's also a personal choice. If you want a plastic surgeon to take care of your laceration, you need to go to a tertiary hospital and request that. Right. If you want just a physician who is trained in laceration repair, then come to an urgent care.
Now, how do people find out about where your facilities are? What are you guys doing to promote this?
That's an excellent question, and it's a struggle for Baptist, particularly in the Broward area. In South Dade, Baptist has pretty much established itself. Everybody knows the name. In Broward, you have a lot of other very strong, excellent healthcare facilities. So when Baptist entered into the Broward market, it really has become a challenge. We've found that word of mouth is our strongest ally. Just from the experience that people have sharing it with families, we've gotten a great more business, a great more volume. We do reach out through Chamber of Commerce, through events just like this, and thank you very much for having me here. But the bottom line, it's word of mouth, what your experience is.
Now, there are many strip malls, shopping centers that have urgent care facilities. That's different than what you guys have, is that right?
Well, we are usually affiliated with what you call a strip mall, and ironically, Publix is always nearby. So we have the same design in the sense of being easily accessible, right, somewhere where you can go do your grocery shopping and then come over and get your medical care taken care of. Right. I think what differentiates us, again, is the standardization, the fact that all of our MDs and RNs, our lab techs are trained, formally certified, that we do have radiologists that read our x-rays in addition to our urgent care physicians.
And you're not trying to take the place of the family physician?
No, quite the contrary.
You're not looking to do well care for these people?
No.
You're not looking to monitor and take care of their high blood pressure on long term, right, or their diabetes or anything like that, is that right?
And that's a very good point, because many times we're asked by patients, can you be my family doctor? And absolutely not, because we have different physicians rotating through each center. And we do try to create a standardization so you kind of see the same familiar faces, but it's not that, nothing will ever replace having a primary care physician.
So you're not set up to try and be multiple visits, ongoing care for a patient?
No, that would be counterproductive.
Well, you know what? This is fascinating to me. I'm Dr. Kenny Levine. We'll be back with Dr. Morrison in just a moment. Thank you.